Yeah, because I guess pharmacology wise, you guys really don't know what you're throwing at the patient, and everybody's going to take it differently. So initially, I mean, it's totally obvious they're going to throw the really heavy stuff at you right from the get-go. So you've got a morphine pump, self-administer, push the button every 6 minutes, and you can watch the thing count down. So you're like, okay, and you just kind of wait for it. But you're just in that much annoying agony all the time that you just can't kind of wait to hit it. So once you do that and you go through that for a couple of weeks, you just kind of realize that, the crappy thing is that I don't have any bowels anymore. Like everything totally shuts down. So that was my first real big gripe with pain medication, is that the fact that it really just totally blocks you up inside. And I think, I know for sure it was 17 days exactly before I had my first bowel movement after the initial, injury. And that was pretty annoying. I wasn't eating a whole lot either, but that's what heavy narcotics will do. So from there, I mean, I must have taken 10 or 12 different medications all in the run of a day, from your heavy OxyContin and oxycodone, one being the quick release, one the slow release, to coupling that with gabapentin and Neurontin for the neurogenic type of burn. That did absolutely nothing, by the way, for me, and I'm sure it does some stuff for some people, but you're on like 2,000 milligram doses a day, just taking them all the time. It didn't upset my stomach or anything, it just did absolutely nothing to help with the neurogenic pain that I was experiencing personally. So, for months and months, I stayed on OxyContin and oxycodone, didn't take morphine. I found, for me, maybe it was just a type of allergy, but I'd always get like an itchy nose. And, maybe that's just the way it is. But as far as mentally what that stuff does to you, after being on that for months and months, you become so quickly irritated by everybody and everything, and your wife, your grandparents even, and, which is really ridiculous, but that's just what it does. It really tends to mess with your head. I mean, that's probably well documented anyway, but, even eventually I got into a little bit of a depression. Maybe it was just kind of what was going on. So with all those other drugs in me, I also added, I believe it was called Zoloft, for a few months to kind of help reset the serotonin levels. That actually seemed to work. Then after that, we started tapering off everything. And with the pain management, people at the Stan Cassidy, we worked out on a calendar, this day you take this much, this day you take this much, and we worked down, down, down. Because I'd done a lot of times where I'm just like, I'm done, and I would go cold turkey, and then I'd end up in the hospital. And I ended up in the hospital a lot of times from just going into withdrawal. So I'd go into withdrawal, I'd lay in a bed for a week, throwing up, not eating, throwing up. I mean, it was a horrendous time for months and months and months, and, eventually just try to work yourself out of that. But it took a lot of tries, and I'm really lucky that I didn't end up being one of those addicted people. And I guess the difference was you're taking it for something, like you're taking it to try to manage your pain, not taking it to get high. So I'm glad I never got that side of it, the take it to get high side of it.